I chose to research staff retention on nursing units in the hospital setting for this project, Leadership and Management. Nurses are a critical part of healthcare and make up the largest section of the health profession. This is one of the main reasons why it's important to nurture and appreciate these critical attributes to healthcare, otherwise known as nurses. Job satisfaction plays a pivotal role in staff retention. The factors that affect the work environment include, but are not limited to, relationships within the unit, shift work and how the shifts vary from employee to employee. So some may work just one specific shift, just day shifts. Some may do a combination of evening and night shift. And then some, as a result of staffing holes and needing to fill in to make up the numbers, may be asked to jump from a shift to a shift that they're not used to working. And shift work, for any of us that have done them, know that it can definitely take a toll, because when you work a night shift, you basically sleep the whole next day, and it also affects your outside of the hospital life, because then you are sleeping through a lot of what you would normally be awake for. Individual nursing values definitely need to fit within the institutional culture with which the nurse works. Expectations within the nursing unit are definitely important to keeping that work environment happy and healthy. So it's nice when your expectations and the unit's expectations are all within the same mindset. Compensation level is definitely a key factor in job satisfaction, and then equality and fairness with distribution of rewards and punishments. So it's important that, not just always the same people are regularly being rewarded, or for that matter, regularly being punished for their actions while in the job. As I mentioned, relationships within the nursing unit can definitely play a key role in job environment and satisfaction. So a nurse manager can directly impact retention and turnover rate. Manager role is critical to staff retention. Hospital staff credit the quality of their relationship with their nursing manager as a deciding factor to remain in their current position. For those of you who have been fortunate enough to have a really good manager, this may not have ever been something that you would have noticed, but for those who have ever had a manager that either did not meet staff expectations, did not have a good working relationship in the staffing unit of the that the nurses were working upon, you would start to notice some friction and may start to see a high turnover rate and just people looking for roles elsewhere, just because that nursing manager is whom the staff looks up to help carry them through the difficult times, help to guide them and direct them and manage them. And when that key factor is not there, the staff kind of starts to fall apart. So having a good, solid nurse manager relationship is very important regarding staff retention. Good relationships between staff nurses, as well as the support staff. So your unit clerk, your PTCAs, it's important that everybody has a good cohesive relationship, because then that helps to create that healthy work environment. It's good to have good relationships with your patients. Some work on floors that may have what we call frequent flyer patients, where we see them pretty regularly and start to develop relationships with the patients. And then some may just work on floors where you see them and then they hopefully never see them again. But even so, when you're able to develop good relationships with your patients also, it really does help to create a good, positive work environment experience. And then also physicians, as well as the other interdisciplinary team members that you may be working with throughout the day, whether it be case management, physical therapy, respiratory therapy. When you work in an environment where it's good and positive to interact with other members of the disciplinary team, again, it really helps to make a good job environment that people are going to want to stay at. Other factors involving job satisfaction and retention of nurses includes patient satisfaction with their care. So when your patients are happy, makes your shift better, so it makes everybody else in that section very happy. Nurses' commitment to their colleagues and the organization with which they work, as well as environmental conditions. Patient satisfaction has been linked to nurses' job satisfaction, which is also shown to be increased when affiliated with a magnet hospital. LGH is currently operating as a magnet hospital, which, as stated, has been shown to increase nurses' job satisfactions when affiliated. Commitment to colleagues and teamwork helps to create a healthy work environment, which ultimately leads to satisfaction and retention. Nursing salaries and retention. So strategies to attract new grads, such as sign-on bonuses and loan forgiveness programs, can disadvantage already employed nurses. So where it benefits the new grads, the employees that have already been working on the floor as nurses actually develop a disadvantage from this because they're not being helped out with these sign-on bonuses and loan forgiveness programs. Salary compression is where new nurses are being started at a higher salary, or nurses that have fewer years of experience are being rewarded with higher increases, resulting in salaries of nurses who have been on the floor or more years of experience in service for that matter are making about the same or just a little over less experienced new graduate nurses, which is actually resulting in some disgruntled nurses and retention issues on the floor. So the recent RN pay increase throughout LGH, some of the nurses on my unit I've noticed are starting to express some unhappiness regarding the fact that they've been there for 5, 6, 7 years and are making roughly $1 or $2 more what these new grads are starting out at who have bachelor's degrees. So this is definitely causing an issue and raising some eyebrows with concerns for retention. Retention strategies. The task of increasing retention of RNs has been argued as necessary to address the nursing shortage. So things that can be used to help with retention is team building social events to build and develop relationships among the staff. This would be getting together as a group of people who all have off on the same day, obviously, or time, and doing something social outside of the walls of the hospital where you can help to build and continue to develop your relationships with the staff that you spend more time with than you probably see your own family sometimes when you're working long days or shifts for that matter, and help to relax together and just enjoy each other's time and company without the concern of bed alarms going off or call bells or phones ringing or doctors needing to talk to you. So this just helps to create a cohesive environment amongst your coworkers. It is important to recognize and reward employees for good performances. So this could be through touch points, just saying, hey, you did a really great job. It's, in my opinion, is a really good part for the manager to step in at this point and just really let them know, hey, I may not have been here when this happened, but I heard about it. So you were recognized to me from your coworkers, or I was told from this person or that person that you really stepped up to the plate and really did a good job, or I appreciate you coming in and filling in a hole, or we had all these extra shifts and you helped to fill that in for us. So it's just really good that both coworkers and manager, for that matter, really take the time to recognize and reward the employees for good behavior. Might be a good idea if there is a specific nurse on the floor who has more of a leadership role, just to check in on a weekly or semi-regular basis throughout the month with the staff to identify if there are any problems amongst the staff within the unit and help to try and resolve these problems. Also, and for the manager to do this as well, because when they're constantly going to meetings or emails or conference calls or here, there, and everywhere, but on the floor, they may not necessarily know what is going on among the staff that they would need to know so they can identify it and really help to try and resolve or fix or find some type of alternative solution to problems that are arising within the nursing unit. This is a really good way to help maintain retention of your nursing staff. So nurse managers need to provide realistic job previews to the new hires. This was something I found really interesting in my reading. I know when I chose to work on an oncology unit, I knew what I was getting myself into. I knew that it wasn't going to be all sunshine and rainbows, and that it was going to be difficult, and we were going to have more sad stories than we were going to have good stories. But for a new nurse, they may not be aware of it. They may just be looking to get a job. So it's important to make sure that nurses are aware this is the type of patients that we're taking care of. These are the type of comorbidities that we see regularly. These are the type of medical conditions that we are fighting with. You may be dealing with a lot of hospice patients. You may be getting a lot of comfort care patients. So this may not exactly be the type of environment that a new grad is wanting to get into. So it's important for management to really give a realistic picture of what the job is going to be and the type of patient population that they're going to be working with for new hires, so that they don't get hired into a position that may not be what they're looking for. So you put all this time and effort into new grads and training them and precepting them and getting them set up and oriented to the floor. And then 4 months in, they decide hey, this isn't what I'm looking for. This is completely off than what I wish somebody would have just told me. So it's a really good way to retain nurses is by making sure that they are aware of exactly the type of job and patient population that they're getting involved with. It's also important to make necessary adjustments among the unit to create a healthy work environment. So ways to create a healthy work environment. It's really important to make our new hires feel welcome to the team. I know sometimes it can be daunting. You want to get into the Pyxis and you have a new orientee trying to pull meds, and it's a 9 a.m. med pass and they're trying to pull 25 different medications, and you just want to pop in, grab one pill and roll. But it's important to keep in mind that we were those new hires at one point in time too. And so it's really important that we take the time to step back and let them feel welcome and help to really provide a positive, confidence building work environment for them so that they feel welcome to the team and help to build, again, those cohesive relationships that we can continue to build and develop throughout the time that you're working with them. As I had said about engaging in team building activities inside and outside of the nursing unit, it's always really great when you're working with the coworkers that you really enjoy working with. It just makes your shift go so much better. For those who are precepting, it's really important to develop a strong preceptorship with the new hires. We want to continue to support them. We want to continue to provide positive feedback for them. And we also want to really help to continue to build their confidence and help them to really develop their critical thinking as well as their skills on the unit. So it's really important that we continue that strong preceptorship with our new hires to make them feel supported and welcome and create that healthy work environment for them to help retain them as staff once they're off their orientation. And it's also important to help support your coworkers with recognition for their help and support during those difficult shifts. So a simple touch point, hey, thanks for helping, everything really does make a big factor in helping to maintain that healthy work environment. It's important to reward and recognize. Touch points, Daisy Awards are always great to get. You can also send them for fellow staff. For those that did not know that, you can actually nominate a fellow nurse for a Daisy Award. Thank you note, simple post-it note on their locker. Coffee cards. If you're a coffee drinker, coffee is always a really nice reward. Potluck parties on the unit. So if you're working a holiday and everybody kind of pitches in and brings in food, it's always really nice when you have food available when you're working, and it's good, delicious, and readily available. And also an Employee of the Month bulletin board is a really good way to help recognize and reward your coworkers and help to maintain staff retention. So retention is important. High nursing turnover rates, short-staffed units, burnout, and poor morale make for deplorable working conditions for nursing staff. When working on a nursing unit that supports a healthy work environment, this allows for salary adjustments to make staff feel valued, has a manager that supports and values the team members and rewards and recognizes staff for their hard work, really makes for a positive work environment. When turnover rates are high, staffing is short, and staff is overworked and underpaid, the staff, the patients, and the medical organization suffer as a whole. It's time to pay attention and step up to the challenge, appreciate, and give back to those that deserve it the most. I have included a short video about how mentors can help to retain new nurses. And mentors and preceptors, when precepting and or mentoring new nurses, it's best to remember to not bring negative workplace politics into the precepting time and allow your new nurses to feel supported in a positive work environment, all while performing their own opinions about how things work within the nursing unit. Help to recognize their strengths and allow the time and help needed to strengthen their